Welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us for another segment. We're going to be speaking with Dr. Lloyd Miller. He's joining us here from Janssen to discuss some new data presented at the 2021 EADV showing TREMFYA provided durable, complete, and almost complete skin clearance. Welcome to Health Professional Radio, Dr. Miller.
Thanks so much, Neil. It's a real pleasure to be on your radio show this morning.
Well, I thank you for taking the time. If you would, give our listeners a bit of your professional background and talk about your role at Janssen.
So, as you mentioned, my name is Lloyd Miller. I am a MD, Ph.D. trained clinician scientist. I'm a dermatologist by training. I currently hold the position of Vice President and Immunodermatology Disease Area Leader at Janssen. My basic role is to lead the Janssen research on our entire immunodermatology portfolio, looking at many diseases across our therapeutic area that affects skin, so any immune-mediated skin disease. And so we focus on underlying immune pathways of disease, so we can apply insights across a broad spectrum of disease areas and bring effective treatments to patients around the world.
Now, I did mention the 2021 EADV concerning TREMFYA. First of all, what is psoriasis, what causes it, and who's affected?
Neil, great question. So psoriasis is a pretty common skin disease affecting 2 to 3% of the normal human population. Patients present with scaly red plaques, can be anywhere on their bodies. The TREMFYA in particular is a focus on patients with moderate to severe disease, which means greater than 10% of their body surface area is covered with these plaques that are very thick, red. Many can be itchy and painful. So psoriasis, I wish we had a real answer of what the actual cause was. So we understand a lot about this disease, and over the past 20 years in the clinic, we've learned a lot about this disease, and we've managed to go from the early advanced therapies that were anti-TNFs targeting tumor necrosis factor, which had some efficacy. But later on, we learned that this disease is mainly driven by IL-23, interleukin 23, that drives these cells called T helper cell 17 cells, or Th17 cells. And these Th17 cells produce IL-17 and other inflammatory mediators that basically exacerbate and mediate this disease. TREMFYA is a first-in-class anti-IL-23 inhibitor that, because it blocks the whole pathway involved in IL-23 and induction of the Th17 cells, it is a broad upstream driver of this disease. And by targeting IL-23 with TREMFYA, we're able to get remarkable control of this disease, and many patients achieve clear or almost clear symptoms. I also want to mention that for many patients with psoriasis, and it's not a small percentage, also suffer from psoriatic arthritis, in which they get an inflammatory arthritis of their joints. And this can be many joints, singular joints. It's a very it's a variable disease in different patients, but the joint disease can cause severe swelling, pain, inflammation, stiffness, and this all can be very disruptive to patients' lives, leading them to have unable to exercise and able to use their joints and able to function properly. So psoriasis is really a spectrum of the skin disease, and some patients also have skin as well as arthritis.
With so many people being affected, is this a relatively easy condition to diagnose, or is it often misdiagnosed as something else?
Well, the diagnosis of psoriasis under the correct trained eyes is, I would say, relatively straightforward with some caveats. So the disease itself, the red, inflamed, scaly skin, they have developed a silvery scale that is usually pretty consistent and relatively with some ease with a trained eye can be diagnosed. With that caveat, though, some psoriasis diseases are often harder to diagnose, especially in patients with darker skin tones. such as African American and Hispanic patients. And in those diseases, the redness, that bright redness you see, is more of a violaceous or purple color, and the scale is sometimes not as apparent. So in some cases, it is actually difficult to make the diagnosis, and often a skin biopsy is performed. And psoriasis looks very characteristic under the skin. So if there's any question about what type of rash a dermatologist or a healthcare provider is looking at, if they cannot make the diagnosis by visually observing the patient, usually performing a skin biopsy is diagnostic in most patients.
Now, I do understand that the information that was presented showed that TREMFYA provided durable, complete, and almost complete skin clearance. Could you clarify those two terms and then talk about some of the safety issues surrounding TREMFYA, if any?
Absolutely, Neil. So when the rating score for the psoriasis to show how patients are doing is called the Psoriasis Area and Severity Index, or the PASI. We like to, and there's also an Investigator Global Assessment, or IGA. We like to see at this stage of development and where we are with treating this disease, we're able to assess PASI 90 responses. That means a 90% improvement, or an IGA, an Investigator Global Assessment, of either 0 or 1, which means clear or almost clear skin disease, 90% clear or clear or almost clear skin. And if we look at the Voyage 1 and Voyage 2 data, which is 5-year clinical data that we collected from patients, TREMFYA was able to achieve a PASI 90 or clear or almost skin in over 80% of patients. And that response was durable for over 5 years of treatment. We also started in the Voyage 1 trial in particular, we also compared it to an anti-TNF therapy called adalimumab. And adalimumab was less effective in this trial, with about 50% of patients achieving PASI 90. And at about 48 weeks, we had switched those patients who were on adalimumab to TREMFYA, and then those patients also improved to greater than 80%, achieving that PASI 90 score. And then that was also maintained for years. So if you look at the data, TREMFYA was one of the most remarkable therapies in this disease, with, again, above 80% achieving that PASI 90 or clear or almost clear skin.
And as far as any of the side effects or safety concerns?
Yeah, so safety, safety is always a concern. And it's something that Janssen looks at in every single trial with every single therapy. And with immune-mediated skin diseases that are not life-threatening, we really want to provide therapies that are safe. So if you look across the studies and looking at both the Voyage 1 and 2, as well as, and that was in psoriasis, as well as Discover 1 and 2, studying psoriatic arthritis with TREMFYA, we really didn't see any major infections, and things we looked for were like opportunistic infections. So they really weren't that different than the placebo patients. We also didn't see any serious adverse events, any serious infections, any malignancy, any major adverse cardiovascular events, and any adverse events leading to discontinuation were extremely low and generally similar between TREMFYA in both the psoriasis and psoriatic arthritis patient populations. I also mentioned that there was no anaphylaxis, there was no serum sickness-like reaction, there was no opportunistic infections, and no active tuberculosis were reported in TREMFYA-treated patients.
Well, if you would give us a website where we can learn more about Janssen and probably peruse some white papers on this subject and many others.
There is a TREMFYA website, www.tremfya.com, and that's they can read more about the TREMFYA, and anything about the efficacy and safety is on that website.
Well, I appreciate you joining us here on Health Professional Radio and offering us this information. Thank you very much for your time.
Neil, thank you so much. I appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Lloyd Miller. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also download and listen in at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.